no matter what the situation, because right away it kind of disarms them, so to speak, and makes them comfortable and feel relaxed. Not all of them, but I just think if you approach them with a smile, it sure helps rather than kind of going up and being all like, hey, what do you want, da, da, da. You know, if you're smiling at them right away and you're making eye contact with them, and I think that helps.
You know, and the Sunday paper had an article about smiles. Did anybody see that? It's in that little section that used to be called the parade, but now it's called something else, you know? It's in the, and it talked about there are two kinds of smiles. There's a smile with the muscles of your mouth, and then there's a smile with the muscles of your eyes and your mouth. They have to go together. And that there is a positive emotional outcome for you and others, particularly when you use your eyes as part of that smile. But if you can't use your eyes, it says, if you just can't go there, you just don't feel it, just use your mouth while you're driving. You know, just make your mouth, you don't even have to feel the smile, it's just the muscles. So, but I think that can really make a difference in other people, and they talked about that too.
I think it's the tone of voice and the demeanor when you approach somebody to represent them. A lot of the students that I see, when they get in trouble with the instructors, and I know the instructors have a hard job having to deal with all the students, I understand that. But also we have to understand that they also come from different backgrounds, they deal with different things, and sometimes they deal with a mental illness that they don't even know.
Yeah.
So it could be a trigger, the tone of voice, the way you talk to them, or the way you address them, and they're reacting to them, and you as a professor going to say, you don't talk to me that way, you're disrespectful. Instead of saying, it seems to me that you're not in a good place, why don't you take a 5 minutes off and then come back and we can talk. Instead of want them to do what you want them to do, because they get more fired up.
And this is Esperanza Maldonado, and she is the campus therapist. And so, the mental health referrals get referred to my office, but the ones that really are, having the most difficult time, I refer to Esperanza. She's a licensed MFT and extraordinaire. And one of the things that I just want to take an opportunity to say is that there's a misconception amongst society that an individual with a chronic mental illness doesn't belong in college, when we know that isn't true. And we also know that the onset of mental illness is often in the late teens and early 20s. And for them to really receive services that are going to be the most effective for them, they need to have multiple hospitalizations. That's the way our system works. It's not really good, but they need to have multiple hospitalizations. So that means that they're going to cycle in and out of psychosis and difficulty and some of the problems. And what Esperanza works with a lot are students that tend to participate, they tend to do things like stalking another student, becoming really focused on something and you can't kind of pull them away, difficulty concentrating. And you have a student that you think is struggling with something like this, refer them to us. This is going, to have a trauma-informed response is going to de-escalate that, but they really need additional help in order to really work through, because we want them to get in the best program, on the best program, so that they can become successful students, because mental illness does not keep somebody from being successful. It does not keep somebody from getting a PhD. It just means that their road to get there might be a little bit more challenging than somebody else. Anything else? Any other examples? So back to the phone.